A lot of times you get asked why you want to come and volunteer your time and efforts with the Flying Eye Hospital with Orbis. For me, this particular mission to Da Nang, Vietnam has been particularly satisfying. Just in the sort of skills transfer and knowledge transfer at the end of screening day and after the first day of our surgery, both of my trainees came up to me and said, you really sort of opened our mind to sort of newer ways to do things, and that's like incredibly satisfying. My name is Dr. James Whelan. I'm a retina surgeon from St. John's, Newfoundland, Canada, here with Orbis on another FedEx-sponsored Flying Eye Hospital program in Da Nang, Vietnam. You never know really what to expect when you come on an Orbis Flying Eye Hospital mission, what the level of care is or what the level of local expertise or equipment they have available. But here they had obviously very good training in the past. The two trainees that I had were very skilled in all the basic techniques of retinal examination and diagnosis and the basic techniques of vitreoretinal surgery. And so really what they were looking for was to advance their care to sort of the next level. And I think we were really successful in being able to do that. So one of the trauma cases that we saw was an industrial accident where a young gentleman in his early 30s had a ruptured globe while working. So the primary repair of that injury was done at the local hospital, but the patient did require a secondary operation in order to try and fully restore vision to his affected eye. So I was able with my trainees to show them how to do vitrectomy surgery in more advanced trauma cases. Their primary repair of the ruptured globe was excellent, and then we were able to take them to the next level and show them that in order to get full visual rehabilitation, these were the sort of skills and techniques that you could employ to sort of help this patient. So now this young gentleman is able to go back to work and be more productive and more self-sufficient and still be able to provide for his family and still work at a capacity where he was prior to his accident. One particular patient who stands out was a young lady who we did surgery on. Before we operated on her, she had hopeless diabetic retinopathy in her right eye and had no vision. In her left eye was headed in the same direction, and when we did her surgery, the next day she comes in, we take off her patch, and now she can see people moving around a room. She can see to walk unassisted, by herself. And when we were done with her, I said, just reach out and touch my hand. And, she reaches out and grabs my hand, and you could almost like feel the hope, She was so happy. We've taken a patient who, unfortunately, in a year or two would have been completely blind, and hopefully been able to show our trainees techniques where they can salvage vision in patients where before they might have thought there was, little or no hope. As a volunteer, that's extremely satisfying. That makes the time you spend here, although sometimes the hours are long and stuff like that, very worthwhile. And not only do we sort of donate our time and our teaching skills and stuff like that, you get to take home the fact that you've really shown some concrete improvement to teach the local doctors how to be better surgeons and better care for their patients, and that's very gratifying.